Hello, my name is Andy Orta, and I am one of the podiatric physicians and surgeons here at Metro Health. My clinical interests include sports medicine and arthroscopic surgery. As a podiatrist, I diagnose and treat a variety of conditions of the foot and ankle and related structures of the leg, conservatively and in the operating room. Today, I want to talk about ankle sprains. Ankle sprains are one of the most common injuries treated in a primary care and emergency room setting. Up to 50% of individuals do not seek formal health care management. These individuals do not receive proper rehabilitation, which could lead to long-term problems. Lateral ankle sprains are one of the most common type of ankle sprains, with a majority of these injuries occurring during sports. Generally speaking, acute ankle sprains can be treated in a similar fashion. Initial management goals are to limit pain and swelling, along with maintaining range of motion before gradually returning to activity. We routinely implement the PRICE therapy, PRICE being an acronym for protection, rest, ice, compression, and elevation. Grade 1 ankle sprains are considered mild and are associated with microscopic injury without stretching of the affected ligament. Clinically, swelling and tenderness is appreciated with little impact on function. Grade 1 sprains have the best prognosis, and generally, we see a full return to activity 2 to 4 weeks after injury with minimal intervention. Rest, icing, compression, and elevation are vital to a quick recovery for grade 1 ankle sprains. Grade 2 ankle sprains have macroscopic stretching, however the ligament remains intact. Clinically, we see moderate swelling, pain, and a greater impact in function. There is a reduction of range of motion associated with instability as well. Grade 3 ankle sprains have a complete rupture of the associated structures. Clinically, we see significant swelling and bruising along with loss of function. Marked instability about the ankle joint is noted with these grade 3 injuries. Grade 2 and grade 3 sprains generally have a return to work and activity 6 to 12 weeks after the initial injury, again, only if proper treatment is performed within the first few weeks, utilizing the PRICE method and initiating early range of motion exercises when appropriate. In the case of surgery, which varies from case to case with the severity of the injury, time to return to work and return to sport ranges from 4 to 12 weeks. Chronic ankle instability is a complication seen in roughly 40% of individuals who suffer from ankle sprains. Symptoms include persistent pain, swelling, and/or giving way in combination with recurrent sprains for at least 12 weeks after the initial ankle sprain. Chronic ankle instability has a long-term association with osteochondral lesions of the ankle and joint degeneration. Chronic ankle instability will likely need a combination of arthroscopic evaluation and debridement of the ankle joint, along with reconstruction of the ankle ligaments that have been damaged by a fellow foot and ankle physician and surgeon. If you have any questions or concerns, make an appointment with a Metro Health podiatrist by visiting our website at www.metrohealth.org/podiatry or calling 216-778-2457. Thank you.